Construction Safety Nova Scotia sits down with construction mental health advocate Andy Stevens from the UK to discuss contracting COVID-19 and preventing the spread and the mental health during a pandemic. My name is Damon Alcock. I'm the Construction Chief Safety Services Officer at Construction Safety Nova Scotia. And Andy is here with us as our mental health speaker for our AGM that will be happening in June also. So Andy Stevens runs his own building company, Eclipse Property Solutions, as well as being on the tools offering extensions, refurbs, kitchens, bathrooms, etc. His company won several awards for outstanding craftsmanship and end product, extension of the year in 2010 and bathroom of the year in 2015. Before this, he was developing for many years. He's also the vice president of the London region of the Federation of Master Builders, where he has been on the board for many years. He has his own radio talk show called The Toolbox Show on Fixed Radio every Wednesday. He writes for the Home Building and Renovating magazine as their expert builder, and also films their how-to videos, which looks at how to build an extension from the initial planning application all the way through the final coat of paint. He has worked on the BBC and Channel 4 in building-related programs. So I'd like to welcome you, Andy, here today to having a chat with us all the way from the UK.
Thanks for having me.
So we'll get right into it. So you work in the trades in the UK, and you've been socially distancing, like they have the requirements over here in Nova Scotia and in Canada as well. But you recently contracted COVID-19. What's been your experience with it, and how serious is it?
Well, I think first of all, people, despite the numbers of people catching it and obviously the death rates as well, nobody is taking this seriously. Now, I'm 44. I'm not a smoker. I'm relatively fit, still been on the tools, ex-rugby player. So, you know, I'm not in bad shape, no underlying health conditions. I started off really with tiredness and a bit of a sore throat. The cough wasn't even a cough. It was this annoying sort of tickle. The fever wasn't particularly high, but then on day 3, I just couldn't get oxygen in. I phoned up the health service here, and they sent an ambulance, and I was admitted to hospital there and then. And I think the hardest thing for me was even though everyone was curtained off, you could hear, because it's a respiratory problem, you could hear people with underlying health problems such as asthma, bronchitis, lung disease, trying to breathe. And there was a 26-year-old woman that came in by ambulance, and the noise she was making trying to get oxygen in is something I'm never going to forget. It was actually, I mean, she was 26 years old. She lived with her grandmother, who was elderly. She was immediately sent off to resus, and then as she was being pushed through on her bed, the doctor's already talking about intensive care. Personally, I don't think she would have made the following day. So this is a lot more serious than people think. I mean, I was lucky that it took about 11 days for me to shake the worst of it off, and it's just the fatigue really. But you know, I'm a lot better, pretty much there now. But everyone underestimated it, including me. You know, when it first appeared, everyone thought it's a bit of flu, but you know, it's the only way of explaining the symptoms badly is if you're at altitude and you've got a big rock on the center of your chest, you cannot breathe. And it's, you know, numbers are still going up. We're still averaging 800-900 deaths a day here in the UK. We're up to just under 15,000 deaths. Now, the figure of that, I, having been in hospital and heard the doctors talking, that figure's not very accurate. And what I mean by that, if I went in with, let's say, asthma, and the COVID-19 killed me, the death certificate would say asthma cause of death. So these figures are a lot higher. They're not including care homes where the elderly live, and they're not including people dying at home. So the reality is that figure's probably double. And there's obviously no sign of a vaccine. The social distancing, we just had 3 weeks added on yesterday. So 7th of May is the next major announcement, if not before. But in reality, you know, we really should be listening and staying at home. The majority are. But you know, we've had a week of good weather here. There's still been people out and about, which, as we were saying earlier, Damon, I think the hardest thing is young people think they're fine, and chances are they will be if they catch it. But if they go to a park and open the gate, an elderly lady touches that gate to go to the drugstore to go and get a medication, it's going to kill her. So I think it's thinking of others, not yourself.
Yeah, that's definitely a big thing in the message that we hear over here in Nova Scotia and Canada as well. And like us, like you folks, the weather is starting to improve, so people are wanting to get out more, and that of course puts people at risk as well. And being sort of self-isolating as we're told to do for the last month or so, seeing the weather starting to come up, it's people's spirits starting to brighten up, and they want to get outside, just from a mental health aspect. So, speaking about mental health, I mean, how has that impacted you from a mental health perspective? I know you're a big advocate for mental health, especially in the trades and construction. How has contracting COVID and living through that affected your mental health personally?
Well, I live on my own after a sort of messy divorce. I was diagnosed with complex PTSD and depression a few years ago, so I've had sort of that in the background, even though obviously I'm a lot better now. It's not the being on your own. The big problem for this is the knock-on effects. The building company I run, we don't know when we're going back to work. We've got some customers saying, "You've got to come in. You've got to come in. We've got a house to finish," and you've got others saying, "Stay away, stay away." And out of all industries, construction's kind of been pushed under the carpet here. The guidelines set by the government were about as clear as mud. And I'm on several talk groups with thousands of other companies here, the boards and things I sit on. Everyone's asking the same question: what should we be doing? Now, construction workers are needed. So we have got all the big exhibition centres here. The NEC in Birmingham, the Excel Centre in London are all now field hospitals. The one in London's taking up to 4,000 patients. So it's great that these construction workers still have some work, but that's a relatively small number. Yet what angers me is when you see the news and you've got Prince Charles doing a remote opening because he was ill, thanking all the architects and military and engineers, and the poor old tradespeople didn't even get a mention. I don't know why construction workers and just looked at as, or just ignored. There's no clear guideline. I've seen 3 abreast in a cab. That's clearly not 2 meters. Canteens, people can't even move in. So they're not keeping social distancing. The mental health side of it is having huge knock-on effects. The biggest thing is financial. I don't know how much the government have been helping you guys, but over here in paper it's looked very good. But in reality, there's only a tiny percentage getting government loans. So, staff have been furloughed, which is where the government are paying 80% of your salary. However, 92% of small businesses in construction, such as myself, we're sole directors of a limited company. And what that means is we are the only ones on the payroll. So I pay myself a minimum amount, which is just over £700 a month, to stay below the tax threshold. Then I take the rest in dividends, like profits, if you like. We don't get anything. We will get 80% of, so we're lucky to get 400 and something quid a month, which isn't really going to go very far. If you're part of a big firm, you'll be furloughed, so you'll still get 80%. Again, construction is struggling. The really, really worrying thing, mental health-wise, but not just in construction, across the country, domestic abuse and violence and suicide rates have gone through the roof. Seriously gone through the roof. And there's now reports coming out in the last couple of days, they're more worried that there's going to be more deaths from people staying in than going out. So the answer to your question, mental health is really being hit hard. Yeah.
Yeah, absolutely. And that's things that people really don't consider, possibly, when you're forced to stay at home, possibly not in ideal living situations and things like that, is the domestic violence and the pressures of, again, you're right, the finance side of things and being stuck at home and how that affects you and how, I guess, how you would react to that.
Well, I think what's interesting, and to back that up, is the government are that worried, they passed a new law this week. If you're living in a difficult environment with an abusive partner, you can go and stay with a friend. So to pass that with so-called social distancing, where you're basically going to a friend's house, that speaks for itself. And I think the longer we're in lockdown, the worse this is going to get, because everyone has got an element of mental health. If it's good, bad, indifferent, ugly, trauma-based, etc. And that, I think now, sadly, that's starting to be seen, because most of us work, most of us, or some of us have got other halves that are either part-time or full-time. when you're in lockdown with your partner 24/7 and screaming kids and no money coming in,
Yeah. Yeah.
it's not ideal.
Yeah, absolutely. So I mean, that answers sort of answers my my next question I had for you was, how is construction over there dealing with either continuing the work or having to self isolate, especially from a mental health perspective. But I mean, you've answered that for sure with just from a general sense across the country on the domestic violence and suicides and deaths. Certainly seeing an increase in that kind of stuff. So on the workplace in construction, Andy, how are companies dealing with the hazards right now on the workplace? You mentioned, you're still seeing folks, three in a cab and stuff like that. But is construction sort of working together to try to stay safe and get through this, or is it every person for themselves? What's the atmosphere over there?
It's a good question, because if you look at BBC, Sky News, the main news channels, they're not reporting on it accurately, and that buggers me, because there's a lot of companies out there, a lot of friends out there, which are going through a whole wave of different emotions. First of all, your big sites, your new builds with 10, 20,000 houses going up. Anybody goes on as a worker and moans about social distancing or hand sanitizing or anything like that, you're off the job, we'll get someone else in. Now that person needs that work, hence they're there. Mm-hmm. So they can't, big firms, not all of them, but a lot of them are basically saying, if you're going to moan, disappear, we'll get someone else. The smaller firms are in a really difficult position because it is financial. Some workers that are on full time are being furloughed. The government are paying 80% of these of their wages. Some that are subcontractors are getting nothing. And then, as we sort of chatted before we came on air, you've got this. If you're doing residential, you've got a very difficult position. You've got some clients moaning that you've got to be in their house to get the finished job done quick, and you've got other clients saying, "Stay away, we don't want you anywhere near us." In reality, I do think the government could have done an awful lot more to make this clearer, because all the talk groups that I'm on, all the friends that I'm talking to across the country, absolutely everyone has no idea. And that's the uncertainty that is ruining people mentally. It's the uncertainty. There's no clear guidelines, in my view, about what you can and can't do. And that is where you wake up each day. Can I go to work? What do I do with my team? I mean, the other big thing, which again, no one over here has talked about, and I've spoken to all the big suppliers, there's no materials. So if you phone me tomorrow and said, right, Boris Johnson's opened up the construction industry, everyone's back to work. Well, they're not, because there's nothing to work with. British Gypsum, which produced the bulk of plastering products here, they're not making any because they have best before dates. So they're worried that with less people working, the bags will sit on the pallet, go out of date, have to be thrown away. So now bags of plaster are going for a minimum of 4 to 5 times their value on eBay. And I phoned up the other day trying to plan ahead, spoke to a big national supplier that I've been with for years, and he said, we have very few branches open. You cannot go into any of them and pick anything up. If you want a delivery, you won't get it. They're only supplying essential builds, such as field hospitals, etc., and the big sites that are putting up new houses. Someone like me doing residential extensions and refurbs, I've got absolutely no hope. The only way is to find a small independent merchant, but then you're looking at a minimum 2-week delivery, probably with half the stuff not available.
Wow.
So it's a bit worse than people think, because the media here are not reporting on it. I spoke with a company, similar sort of call in America last week, and they were astonished to hear that. And there's newspapers here, which I work with, that are now going to be running these stories, because people need to hear about it. There's no point in planning to go back in 3 weeks when you can't get a bag of plaster.
Yeah, well, that's interesting. It was one thing I was going to ask you is, what do you suggest that people should start doing now to start preparing for life to, we'll say, go back to normal when it finally goes back to normal? Like, what can people do now and companies to start preparing for that?
Well, I think first of all, if we take a step back, at the moment it's the big unknown. To me, there's a lot of positives to come out of this. Now, this might sound absolutely mental, bearing in mind I've been in hospital not being able to breathe, so I've had it. But let's take a step back. Trades over here, we are awful at a few things. Our van gets cleaned once every 2 years when it gets serviced. So take a bit of time out. It's your work vehicle. You know, go and make it, tidy it up, clean the back of it out. You know, it's amazing what you find in there. I'm working with a big publisher here. I'm going to be doing some videos. We're doing competitions. Now, what can tradespeople make with what's in the back of their van? And then the top 20 ones we're going to take to one of the hospitals to give to the staff to thank them. So there's positives to come out of it. Get your kids involved. You know, if you've got kids that enjoy helping you, go and get a few bits of wood or some copper pipe. You can make anything. So the other thing is as well, it's we're not good at paperwork trades. You know, we work with our hands, not our heads. So it's a chance to sort of speak to your insurance companies, make sure you're getting the best deal. There's a lot of the sort of back end stuff we can do, chase debts that we've not had time to do. So I think there is a lot of positive things to do. But back to your question, I think the mental side of it, if you've got a team of 1 or 101, picking up the phone and just saying, "How are you, mate?" That is huge. Mm-hmm. And as far as I'm aware, there's not that many companies doing it. It's kind of out of sight, out of mind. But, you know, over here, we lose 2 workers in the construction industry a day to suicide. And I would have thought it's going to be a lot worse than that with what's going on. So, you know, if you've got a management team in a bigger firm or just a boss in a smaller firm, picking the phone up to your guys and girls saying, you know, "How you doing?" And appreciate we can't do a lot at the moment, but, you know, when we get back, and almost having a bit of a crack, because what I've found before is just by asking someone how they are can be the catalyst to someone opening up. If you said, "Meet me in an office at 10 o'clock on Friday to talk about it," they will clam up and not say a word. It's being there at the right time, and it's like floodgates. Once that person starts talking about it, they won't stop. And it's just a huge release just to have someone to sit there and just listen. Don't have to say anything back. So I think that it's good at the moment for people to stay in touch with each other. Maybe, you know, WhatsApp groups or Facebook groups where we can, you know, one thing we're good at, Trade, and that's having a laugh. You know, we do enjoy going to work. And, you know, if we can keep that going on social media or with phone calls, I think that's great. But planning ahead, it's tough because we just don't know. As I've mentioned, materials are short in supply hugely across a lot of sectors, plastering being one. There's talk of other sectors that we're going to be short of as well. I think it's making sure you've got everything in place. So the contract you use, does it include price increases on your materials for adverse issues such as coronavirus or environmental issues? Because, you know, we're talking 20-30% increase on some materials. If your contract's not got that in, you're going to lose money. Mm-hmm. So I think it's getting all your back end stuff, which us traders are rubbish at generally, getting that in order before you go back, and then you haven't got to worry about it when you get back to work. It's literally straight on the trowel or chop saw, whatever you use, and you can plow on with what you're good at. So spend this time getting your back end paperwork up to date and clear.
That's a great point. I think for a lot of companies, not only in construction, quickly realizing how unprepared you know, they were for something like this from a business continuity and right from a contract purpose is how do you making sure you account for those cost increases or time overruns and things like that. For sure, that's great advice. I like the idea of cleaning out the back of your van to see what you got in there and see what you can make. I think that's a great fun thing to do.
It's a fun thing to do with the kids, because you know, young kids love helping their dad or mum who wants to clear the van out, and it's actually quite funny what you can find in there. Mm-hmm. You know, the worst thing we have is small materials. You know, your screws, your nails, whatever that you probably think you haven't got any left. And there's boxes of them, but you just not cleared your van out. Mm-hmm. You know, you can find bits of food from 4 years ago. It's amazing what's in there.
Yeah, for sure. So you mentioned from a mental health perspective, and it's a great point of companies taking the time of, you know, calling their workers just to check in to see how they're doing, for sure. And I think that's a great idea, and I hope everybody you know, watches this video and takes that on just to check in with people, especially if there are companies that are no longer working and they've got workers sitting at home to touch base with them, show that they care. What would you say to the individual worker? What can they do for their own self-care from a mental health perspective if they're, isolating, or even if they feel that they got to get up in the morning and go to work and they're feeling that anxiety of, am I going to catch something today? What would you recommend to them?
Well, first of all, the ones that are self-isolating, the first thing you do when you wake up, don't think, I'm stuck at home. I can't go anywhere. This is crap. I hate this. Not feeling good. What's happening? Now, how long we can flip it? Because the more positive thoughts you have, the better off you're going to become. And if you think, right, I know that I'm going to be at home for the next 2 weeks. I've got her indoors nagging that the cloakroom needs finishing. I've got a bit of grouting to do on the splashback. I've got the decking to finish. Do your bits like that. We work with our hands. My old house, I was in there 10 years. I never siliconed the toilet to the floor in the cloakroom. So when the kids went to the toilet rocked. They loved it. It was like a little ride. 10 years. And all I needed was a better silicone. So use this time to do things in your own house. Look at it in a positive way. A lot of us work long hours. The time we've got with our kids now is invaluable. We're not going to get this back. So if it means using your daily allowance of exercise, taking them out for a big walk, building a den, whatever you're doing, there's a lot of positive things to take from it. But I think the ones that are, when am I getting paid next? How long am I going to be stuck at home? You're almost bringing it upon yourself. And it might sound almost unrealistic, but I've found the ones that are being positive about this, and there is a lot of positives from it, are the ones that are becoming a lot sort of better mental health wise. The ones going to work, I obviously don't know the exact sort of laws and everything over there, but here, the bottom line is if you're part of a big firm and they're not adhering to the guidelines of the social distancing, etc., then you don't have to work. And yes, I mentioned earlier, you'll probably get told to go home and not come back. But one thing, when we're off lockdown, everybody's going to want builders. Because what other people have been doing, if you and I were planning our own build or extension or refurb, we'll do it end of the year. We've now sat down with families. So actually, why don't we start it in a couple of months? We've got everything ready. We've designed it. There is going to be a lot of work out there, a lot of work, either to finish off, but more importantly, new work. Mm-hmm. And I think that's a good opportunity for people to almost have a fresh start. If you're not happy with the company you're in, they want you to do long hours. You're three abreast in a cab. They're not listening to social distancing. Bin them. Now, I know there's the financial worries, but believe me, I'm going through it. And it's amazing what you can live off. Yeah. You don't need to spend fortunes on food each day and, new clothes and this and that. You can literally live off, very little a day. And I think I feel better for it. I've had a real refresh in what I'm doing. And also the way that I used to work wasn't great because now I could look back and see where I was going wrong. So using this as a positive time to look at, if you're contracted to a firm, is that the right firm for you? If you run your own business, what can you do to improve it? My list is as long as my arm. But you've got to be real with yourself. Life's about being happy. And yes, we need to go to work. Yes, we need money. But do you know what? If you can be happy by maybe doing a slightly different job or earning slightly less or working closer to home or seeing your family more, use this time to look at it and research it more, because I think a lot of people can go, right, we've got another 2 or 3 weeks. Let's have a sit down, talk to the other half, the kids, look at what's potentially better for me. Because you get stuck in a rut. Get up in the morning, go to work. Self-employed, you go and look at a job, come back, price it up. You might have time to eat something, go to bed, repeat. This is the time to reset.
I think that's a great message to leave on, Andy, is that positive message from a business perspective, taking this time. I mean, we're all going through tough times right now, and especially, considering getting that message from yourself, who's not only had a huge business impact, but a personal impact from contracting the virus itself. From a business perspective, taking the time to look at the positives, how you do those business improvements, streamline things. Is it the right business or what that you can be in? And from a worker's perspective, taken the time to assess, what's important to you. Are you in the right line of work? Is there ways to work on appreciating your family time? Myself, I have myself, my wife, and our 2-year-old at home now, 24 hours a day. And you appreciate those times where you can take the little one outside and just watch her run around in the backyard and just laugh. So yeah, taking those positives and doing some self-improvements with yourself and your family, and taking the time to really assess all the good things in life right now. I think that's a fantastic message.
Yeah, take the positives out of it, because every day negative things happen, but it's how you react. And I think turning what isn't a great situation into a positive with the things we've mentioned. Some people, big burly bricklayers and ground workers, I know, are meditating now.
Mm-hmm.
Because that's their way of getting through it. So it's taking a step back and just evaluating what you're doing with your life. Are you happy doing it? And now you've got a couple of weeks downtime. Give it some thought and work out what's best for you and your family.
Yeah, no, that's great. Thanks very much, Andy, for taking the time with us today to have a chat and offer your personal perspective from going through it, and the perspective from what's happening over in the UK. Very similar to Canada with regards to the work life and the restrictions and things like that. I think you in the UK are probably a little further along with the impact of the COVID virus for sure than what Canada and Nova Scotia is right now. But so hopefully we can take some lessons learned from countries such as the UK and elsewhere to be able to stop it before it gets to that point for sure. So again, thank you very much for taking the time to speak with us today.
No, you're welcome. And it's funny that when Jonathan called me, Halifax is a town quite close to my heart. I don't know if he's told you, but in 2003, I came over with the rugby club London Welsh to play in a tournament in Halifax. And a friend attended a friend's wedding where we sang in Welsh at his wedding. So the Tars, rugby lads and everyone, best to all of them, because we're still in touch. So yeah, great town, Halifax. It's hopefully come back very soon.
Oh, that's good. We're hoping to get you over here, at least for our AGM or at another time, and be able to host you and do some more great work on mental health and construction for sure. Yeah. So thank you to Andy. Thanks to everyone who's taken the time to watch the video. Whether you're currently working or you're in isolation, check out our constructionsafetyns.ca website to stay up to date on all the latest with COVID-19. Get your safe work practices and guidelines on how to work safe. If you're looking for training, we now have a full suite of online training for people, so that you can safely take the training to keep you qualified to stay working if that's becoming an issue for you. Also, you get some news, printable signs, fact sheets, all free online pandemic planning and mental health training. If anyone is watching and you are in need of mental health supports, you can find a huge range of support through the Mental Health Foundation in Nova Scotia. So please go to mentalhealthns.ca, or if you're in immediate assistance, please call the mobile mental health mobile crisis team at 1-888-429-8167. Thank you all for listening. Thank you to Andy. Everybody take care and stay safe.